Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello everyone, I'm Dr. Sanjeev P. Sahni presenting to you another episode of JIBS Infotainment. Today, we would be discussing palliative care or care for the terminally ill and their families. Consider a person at the terminal stage of cancer. The symptoms and pain associated with the disease, notwithstanding the treatment of cancer itself with chemotherapy sessions, dizziness, protracted pain, etc., is known to be very distressing. Disease like this also cause a lot of distress to the caregivers and family members of the patient. Under such circumstances, how do we decide when the adversities associated with procedures used to treat a patient have surpassed the afflictions associated with the disease itself? What can be done in order to minimize the indignities that the terminally ill and their caregivers have to endure? Palliative care offers a way to address this issue. It is an interdisciplinary approach that aspires to ameliorate the quality of life of not just the patients but their caregivers as well. It employs various interventions ranging from emotional, physical, psychosocial, rehabilitative, and spiritual to mitigate suffering. The World Health Organization defines palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. Palliative care addresses the quality of life by catering to three aspects of health care. Firstly, it focuses on the provision of relief from suffering, both physical and emotional. Second, focuses on improving the communication between the patient and the physician and strengthening the process of making informed decisions. Third, addresses the concerns of care continuity by assuming its uninterrupted presence across settings like hospices, hospitals, homes, and even facilities that offer longer-term care. So, India is a country with a substantial proportion of a rapidly aging population, and with it comes a growing number of patients with life-limiting terminal diseases. According to a recent report by the Ministry of Health, only 1 to 2% of patients suffering from life-limiting illnesses have access to palliative care in India. Comparing it with the global average of 14% gives more perspective to the gravity of the situation. Though the factors like lack of infrastructure, training, and awareness play a major role in causing the situation, other factors like flawed perceptions, attitudes, and beliefs also contribute to making the situation worse. Patients and their caregivers are often not aware of the availability of the palliative care across settings, and often these services are only employed by economically well-off patients, as most of the terminally ill find it hard to afford these services. Even in cases of richer families, patients often refuse palliative care as they consider it might increase the economic burden on their families. Sometimes it's the families or caregivers that consider it a lost cause and don't want to spend more on tending to a person who might not have much longer to live anyways. In such cases, community palliative care centers, etc., might help. Another perception that exists about palliative care is that it is another form of giving up on the care. The caregiver or the family might harbor guilt about not trying to find more interventions that might cure the disease. It often leads them on a wild goose chase of therapy. Indigenous treatments, medication, surgeries, etc., often at the cost of increasingly distressed patients. Some of these interventions might even work, but they inevitably lower the quality of life of patients and deplete the finances. Sometimes patients also think of palliative care as abandonment or giving up. They may even nurse feelings of resentment against the caregivers for the same. Misperceptions aside, in practice, palliative care has been known to improve the quality of life for both patients suffering from a terminal illness as well as their caregivers or family members. It appears relief from both pain and symptoms, psychosocial as well as spiritual support. It is a comprehensive approach that starts from the diagnosis and continues till bereavement. And it can be provided across facilities ranging from homes, community centers, and tertiary facilities too. There just need to be a push towards making people aware of the benefits and dismantling misconceptions about palliative care. That's it in this video. Keep watching JIBS Infotainment for more informative content. Don't forget to like, share, and subscribe to our channel. Thank you.